Hello, everyone. Welcome to Post COVID-19 podcast, Building a Stronger Healthcare System for Safe and Healthy Future. Brought to you by Health Intervention and Technology Assessment Program, HITAP. Podcast is being funded by
Ministry of Public Health, Thailand.
The series pictures what the world looks like after the COVID-19 times, particularly for health systems in Thailand, and what health components we should build to protect the society. Today, I am Dr. Dimple Bhutani, a project associate at HITAP, and I will be your host. We have our founding father of HITAP, Dr. Yot Teerawattananon, joining us to take us on this journey of learning on how COVID-19 pandemic shaped our healthcare system and how the world adapted to the pandemic times and what should we build together for a stronger and healthier future. Welcome, Dr. Yot. Dr. Yot is a medical doctor and health economist by training. His work have been used to inform health benefit packages in Thailand and everywhere around the globe. He provides technical capacity building and health technology assessment and health economic evaluations. So welcome again, and I hope you're doing well today, Dr. Yot.
Hi, I'm doing well. Thank you very much for inviting me to join this podcast.
So as we know, during the beginning of the pandemic in early 2020, Thailand gained many compliments by international leaders for having a good pandemic control. But later on in the year 2021, along with the new variant of SARS-CoV-2, Thailand, like any other country, also faced severe problems which caused number of infected people to unexpectedly increase, and there were several cases of dramatic hospitalization and even death. Dr. Yot, can you tell us about challenges you have had at that time of pandemic? What was the major change in health research and healthcare delivery that you observed?
I think it's very important questions. It's already 2.5 years, I think, since I first experienced about the world with COVID pandemic. I can see, especially at the beginning of the pandemic, there are a lot of unknowns and uncertainties issues surrounding not only about research, in fact, in policy and practice. So because the world never experienced COVID before, so we don't know what is the cause of the cause of the serious health problem of people infected by COVID-19 and how we can prevent them, how we can treat the patient, etc. So I think looking back from now, I think in past 2.5 years, we learn a lot. So it is actually we need to appreciate the effort made by scientific communities as well as healthcare workers around the world. So my first point that is clear to me that I never seen before something that is so unknown and uncertainty, but very impactful to humanities. Second one is as a researchers working for the Ministry of Public Health in Thailand, and HITAP also have international unit who are working with many country government. We also see something that is very different from the past. Is about the fast pace of the work that we need to do. We need to do the work in a very fast manner because sometimes decision maker want to make a decision within the matter of week or days because you can see the number of COVID infection can jump, can double, triple within a few days or week. So that decision maker have a lot of pressure to do some things, and the society as a whole also very worried if you see the number increasing. So they always ask researchers to address their policy questions within a matter of week or months. So this is something that again we never before working in a very fast pace like that before. But I think so far. Not only HITAP, I believe researchers around the world who need to do research in response to policy demand for COVID already adapt and adopt the way they work. And I hope this will be continue because for sure before COVID we discussed a lot about how we can make a timely manner of policy research. to address policy question. I think COVID make us changing persons. We now work faster than before. Another point is about the limitations of research methods and approach that we can do during the COVID, especially during lockdown. We cannot interview people in person. We cannot have a focus group meeting in person. We cannot collect primary data in communities, etc., because lockdown and the COVID measures. We cannot have international consultations, meeting, etc. So we need to adapt to live and work from home and work online, something like that. So I think that make a lot of adaptation to. Luckily, that I think for HITAP and we have made a lot of good relationship with international partner and domestic partner in the past. So to switch everything from in person to be online for 2.5 years is not impact us a lot. But I believe if we keep continuing this for long, it may have very impactful to the way that we work and we collaborate globally, regionally, and domestically. Luckily, now we can see that we can turn back to even not normal, but it's almost normal, that we still now can enjoy a face-to-face meeting, focus group discussion, etc. And the last point for me is about type of research. Before we work, our work focused on health policy, but during the COVID time, we were requested and asked by the government to address some thing that is not directly relevant to or related to health. For example, we were asked to provide information about how the country can opening the borders, how we can reduce number of quarantine and tests so that we allow tourists and business person to come to Thailand and vice versa for Thai people to go abroad, something like that. And a lot of economic related questions come to us. So I think that is a good way to make it multidisciplinary research, and our team need to learn and adapt. Another obvious one is about real world data and digital health issues. That is something that is not much that we worked before COVID, but now it's become core part of our portfolios.
No, thank you very much. I think what you have said is really insightful. So basically, we are not back to normal. We can never be back to normal. We are adapting to a new normal, wherein we have to realize that in order to deliver impactful research that can help policymakers and governments across the world, we need to adapt to systems and we need to fasten our capacity, build our capacity that can have meaningful impact. Also, I think you all highlighted about the real world data and how we need to work in quick manner. These are quite powerful and impactful words. And I think we at HITAP also working on real world data, more to talk about that in upcoming episodes. But now I would like to switch and ask you about a comment that was recently made by Director General of WHO, Dr. Tedros Adhanom, who said that we are not there yet, but the end is near. Do you think that we are at the end of COVID-19 pandemic, or do you think that already happened a long while ago? Can you comment on that?
Good. I think it's very interesting questions. First, that I need to talk about Thailand, because our own Ministry of Public Health and the Thai government just announced the end of the pandemic. Now we are lifting our emergency law, and we are now no longer make COVID as a serious public health threat, but we still keep monitoring COVID situation in Thailand. So I would say implicitly the Thai government declared the end of COVID. I'm fortunate to be traveling to a few countries in the past few months, for example, in Singapore and India. I can see in these two countries even more relaxed in terms of COVID measure than Thailand. And now many countries government also not request you anymore to do COVID test, even showing the COVID vaccine certificate, etc. So I can see. I heard from my friend who's traveling to Europe and America. They say COVID is finished long before our region. So I can see that even COVID starting almost at the same time for every country, especially when the WHO declare the COVID is global health threat and pandemic. However, when finished, I think different country may perceive that they already ready return to normal or called post-COVID before other countries. I think this reflects a few things. The first for me is that I think we know how to declare the pandemic. The WHO know that, but I think we are not very clear how we declare the end of the pandemic. I think the WHO, as you said, not yet declaring that the pandemic is in, because the WHO they need to look at every countries, and I think they shouldn't make the false or misinformations that every country now safe. I believe they need to be very careful to say that. So you cannot support to have the WHO declare COVID pandemic very now, even though some countries already done. The second one is that is also show about health inequities. You can see the pandemic underlines the important global or public health problems about inequitable access to technologies. At the beginning, is about personal protections, masks, and then about ventilators, and then now it's about COVID vaccines and treatment and medicines. So these have happened before on cancer, on NCD's interventions, but COVID it make it even stronger case that we have so much inequitable access to technologies. Thailand is as an upper middle income countries. We are actually midway. We are not so fast accessing to technology, but we are not so slow as compared to low income countries. But we can see our own problem too, even within the same countries, the poor and vulnerable people compared to the rich and better off people. So that is the thing that perhaps give us a very good remind our room for improvement in global health and domestic health policy. To sum up, I don't think we have a clear definition of post-COVID conditions. I look at the WHO website. They only say about post-COVID condition. It means they refer to the people who infected by COVID and have a symptom after COVID infection. So they not say when and how they can say that the country are in post-COVID era or times. So they only talk about the clinical symptom of people infected by COVID before. I don't see that every country will have the same definition too. So it depends. But I can see now many countries now, especially the countries that have high access to vaccines and have good health infrastructure, they are now more confident to opening up the country and back to normal.
Thank you so much. I think I've learned a lot. We definitely, as you rightly said, that we don't know. We know how to define what is the start of pandemic, but we don't know how to define what is the end of pandemic. More so, like diplomatically, WHO has indicated that we are at the end, and I think several other countries have transitioned already to the post-COVID world. This is like really interesting from the perspective of like how governments across the world are prepared for their responses. I cannot help but think that even though we were definitely not prepared when initially COVID-19 hit us, the lessons that we learned from earlier outbreaks, such as that of HIV/AIDS, we definitely knew how to conduct surveillance, we knew how to detect cases, and we knew about the quarantine policies. But the healthcare systems now, as compared to what we were 2.5 years ago, are a bit more prepared. I would like to ask you that what changes do you have you seen in the capacities of health systems, and how do you think that we are preparing for responding to a future pandemic?
Okay, thank you, Dimple, for the questions. We were requested by the Thai Minister of Public Health to think about what and how healthcare system in Thailand can be improved after COVID-19's end, and that is one of our research questions got from the government a few months ago. So we did a few primary work conducting surveys amongst healthcare policymaker in Thailand, and we come up with 5 major issues that the Thai government should do or should focus for preparing for the post-COVID. The first thing is about actually we come up with the acronym health, HEALT. So the H1 is the first, is about human resource. We see that how important human resource during the COVID, and many countries I think they appreciate that health professionals are a backbone and are key factor make us survive to post-COVID era. So, but again, COVID also remind us that human resource for health need to adjust themselves as well, because during the COVID time, I think we need to turn from face-to-face meetings among doctors and patients to be online, and then the nurse need to also taking care of COVID patients using robotic instrument, etc. So many and we need to do a lot of telehealth during that one. So these are the things that perhaps human resource for health need to change, need to find a new way of working after COVID. So we are now doing research on what skills and practice that we need to empower our human resource in the future post-COVID. That is the first thing about human resource. The second one is about environmental health. After COVID, I think the next challenges, mega trend of our world is about environmental issues. I think a lot of people also talking about health system as a key part for us to deal with environmental or climate change problem, because climate change will create a lot of health emergencies in the future, about natural disaster, about another pandemic, etc. So health system need to be well prepared for that one. But our work is a little bit different from that. It's because a lot of people doing on this part of health system and environmental issue, but we are looking at how our health system contribute to the problem of environmental issues. We look at how health system in Thailand, how much health system in Thailand contribute to greenhouse gas emissions. And we also learned that because during COVID, we use a lot of disposable instruments, we use a lot of PPE, and then we make a lot of hospital waste. So we need to think how we pay back to the environment by reducing our greenhouse gas emissions from health sector. So we are assessing the contributions of healthcare provider or health system as a whole in greenhouse gas emission, and we will identify the way to make impactful reducing greenhouse gas emission from health system. The third one is about communications. We found that communication is very important. Advice and communications we need to do better than we did during COVID time, because actually we still have a lot of people who are vaccine hesitant in Thailand. Even we have many millions, 30, 40 million people vaccinated, we still have about 20 million who eligible but not want to come to get COVID vaccines, for example. So I think it's advice and communications in health. We need to empower the public, and we need to empower ourselves, healthcare provider, to do better in advice and communication in health. The fourth one is about L, is about local authorities. Just this week, half of our primary healthcare in Thailand, called Health Promoting Hospital, now transfer from Ministry of Public Health to local authorities, and we support to see them all transfer to from Ministry of Public Health to local authority in the next few years. So this means that the Ministry of Public Health need to work collaboratively with the local authority in the future. We hope that this transfer of the health promoting hospital throughout the country is around 10,000, which is a major part of healthcare system in Thailand, or healthcare provider in Thailand. We hope that to see that this transformations will make a better impact to health system and the society as a whole. But to achieve this, we need to have good working relationship and find new ways of or new mechanism that the Ministry of Public Health can work with local authority. So this is another challenging issue. Next one is about social determinant of health. We see that during the COVID, you see a lot of people who are vulnerable, worse off, they get a more serious impact. Perhaps they have higher mortalities compared to the higher socioeconomic status. People with disabilities also have a lot of difficulties during COVID, and that is and social dependent of health is not only impact about people and COVID, but also impact on the NCD and mental health and others health issue. We see that as I informed before, that COVID show us how inequitable we are in society. So I think we need to be more serious about tackling social determinant of health, and we should use the COVID as a leverage point to do that. And on the last one is about technologies. So the technologies, we are preparing now that there will be more technologies coming up after COVID. And as you mentioned, the HITAP is assessing health intervention and technologies to be part of universal healthcare coverage. We need to work faster, and we need to work more in different mode with different type of technology in the future. There will be digital health, there will be personalized medicine intervention, etc. And there will be more and more of super high cost technologies coming up. I heard that by the end of this year, there will be one drug for treating for one patient, but the cost can be $1 million, something like this. So I think even high income countries will have problems. So let alone for us middle income countries, I think we need to be very mindful how we cope and how we work with industry, with health professional, in order to ensure access to essentials health technology, but at the same time we not bankrupt ourselves. So to sum up, the acronym H is human resource, E is environmental health, A is advice and communications, and then L is local authorities, T is technologies, and then the last H is about social determinant of health.
Wow, that is remarkably interesting. The acronym HEALTH. It's indeed a new way to take on health. It will be extremely exciting to hear more about each of the components that you said in upcoming episodes. We can see how they can strengthen our healthcare system in this transitioning and uncertain times for the existing problems such as aging, chronic non-communicable diseases, and the escalating mega problems such as climate change. So, everyone, in the next episode, we would be looking at other perspectives that will strengthen health systems in Thailand after the pandemic times, such as environmental health, local governance, digital health, telemedicine, and health financing. Stay tuned to our YouTube HITAP Thailand channel. We will come back again next week. Don't forget to click, share, and subscribe to our channel for more insightful matters. Special thanks to our speaker today. Really, we appreciate your insightful remarks. If you have been listening to Post-COVID-19 podcast series, this podcast is produced by HITAP Thailand, a semi-autonomous research unit under the Thailand's Ministry of Public Health since 2013. At HITAP, we appraise a wide range of health technologies and programs, including pharmaceuticals, medical devices, and beyond, to inform policy decisions for the government.